We have one of the best healthcare systems in the world. If you're very sick, this is the place to be because we do a great job of taking care of very sick people. We also do a great job taking care of all the oddball illnesses and hard to diagnose things because we do such great research in this country. In fact, people from all over the world come to this country if they have a significant healthcare problem. On the flip side, we don't do such a great job of taking care of chronic illness, prevention, and based on a number of health factors, we're not a very healthy country, especially when you consider how much money we spend on healthcare. Right now, we spend over double what the average industrialized nation pays for healthcare in their country, and we don't really have the health to show for it. Part of that problem is the overhead in our healthcare system. Our overhead is 25 to 30% of our healthcare costs. In most countries, overhead is only 5 to 10% of healthcare costs. If we could cut overhead, say 10 to 15%, we would save about $400 billion a year in healthcare costs. That's a lot of money. So we need to become more efficient. Healthcare reform is trying to change some of this. It's very, very hard in this country to pass big legislation. You have to have bipartisan support, which is hard to get these days, and a lot of people have to agree on very significant changes. In 2010, we did pass the Affordable Care Act. It's a very large law, and it is more than just about insurance. That's all everybody hears about in the press, but it also helps change our entire healthcare system. We have a problem with poor access to primary care physicians, we do a poor job on the preventive care, and the law aims to improve that. So it's important for people to understand the entire law, so we quit talking about repealing the entire law. We just need to fix the bad parts of the law and move forward with the really good parts of the law, because there are some in there. Now, what I'm going to do today is give you what I call the Cliff Notes version of affordable health care. Basically, I read the whole 2,409 pages of the law, and in the next 10 minutes, I'm going to tell you an overview of everything that's in the law. And it's actually pretty fascinating. So Title I is called Quality Affordable Health Care for All Americans. This is the important section. It's the part that covers insurance. It's 374 pages, and this changes how insurance is sold. This is not a government takeover of health care. You will not buy your insurance from the government. Basically, what changes is 4 things. Right now, health insurance is not a guaranteed issue. Health insurance, if you are sick and you're an individual, you cannot get health insurance coverage. This is why we have close to 40 to 50 million people who are uninsured in this country. Healthcare will be sold on a guaranteed issue basis, so no matter how sick you are, you cannot be turned down. And no matter how healthy you are, you cannot be turned down. The second is insurance will be paid for based on 4 factors, none of them which include health. So the 4 factors are your age. Older people will pay no more than 3 times what younger people pay. Where you live. So high expense areas such as Miami, New York, Los Angeles will have higher healthcare insurance premiums than, say, low cost areas such as Palatka, Florida. 3, how many people are in your family. And 4, the only lifestyle factor they included was tobacco use. Tobacco users will pay 1.5 times non-tobacco users. I wish they would have included obesity as a lifestyle factor, since 68% of our population is overweight or obese. However, this lobby is very large, and the law would have never passed had they included obesity as a lifestyle factor for health insurance premiums. The third thing, you will buy insurance the same place as you get it now. So through your large employer, your small employer, individual market. So same place you get it now, and people who are on public programs, so like Medicare and Medicaid, will continue to get their coverage there. And the final thing I want you to remember is that people who are under 400% poverty level, so say a family of 4 making under $93,000, or a single person making under about $43,000, they will get premium tax credits to help pay for their insurance. So these are things to help people be able to afford the insurance they need, and they'll be able to get the coverage they need. So it's not perfect because we took a very complicated health insurance system and we made it more complicated, but it was what everybody could agree on, including the health insurers, the public, and our legislators. Title II is called Role of Public Programs. This is 221 pages dedicated to changing how we deliver health care in both the Medicaid populations, Indian Health Services, and other public programs. This is the part the Supreme Court had a hard time with, is that all states provide Medicaid now, and the federal government pays part of the bill, the states pay part of the bill. In health care reform, all the states were going to have to expand Medicaid coverage to those under 133% poverty level. So anybody making under $15,000 as an individual. Now, the problem with this is that the law said if you did not expand Medicaid coverage, we were going to cut all your Medicaid funding. That's a big deal. It basically forced the state's hands to expand Medicaid because everybody has significant people on Medicaid, and just to stop those programs would have been a fiasco. So the Supreme Court said this is too onerous, and states, you cannot cut off states' funding if they decide not to expand Medicaid. So there are some states that say they will not expand Medicaid. This is probably unfortunate, though, because the federal government does pick up the tab for the 100% for the first few years, and then gradually decreases the tab to the states paying no more than 10%. And the states, a lot of states don't realize that if they decide to expand Medicare and they find it's too expensive, they can always stop it later. So that's been shown that can be done, and so hopefully most of the states take the opportunity to expand Medicaid. Title III is called Improving Quality and Efficiency of Healthcare. 501 pages. This is the most important section for doctors. It changes how we deliver health care in this country. Right now, we're a very paternalistic system. You go to the doctor tells you what to do, you go home and you do it or not. It's not really very efficient. When we have a team-based approach to care, it does much, much better. The patient is the center of the care, and you have a team of people working around the patient. And the patient is a part of the team, and including the patient family and ancillary care providers, nurses, so everybody else will have more responsibility. This is a good thing. It also moves us away from the fee-for-service system. Doctors right now get paid on how much they do. So the more doctors do, the more they get paid. So there's an incentive there for them to do a lot. And that's one of the other big problems in this country. In addition to overhead, we have a significant problem with overuse. We do too much medicine in this country, and that's been proven. So we're moving away from a fee-for-service system to a qualities-based payment system. Doctors will be paid based on how well they deliver your care. Are they providing all your preventive care? Are they following through on your wellness services? Are they following through for diabetics? Are they doing all the testing that diabetics need to have done? So this will be measured, and the other change that occurs here is doctors will be required to use electronic medical records. That's how they'll track it. They'll be able to look at a doctor's patient population and say, hey, they're providing good preventive care to 95% of their patients, so they get a bonus. And those factors haven't been determined yet, but that's how it will be tracked. So this really changes the delivery of health care. Title IV is called Prevention of Chronic Disease and Improving Health. A lot of good people had some input to this law. The American Academy of Family Physicians, Kaiser Permanente, Mayo Clinic, and they realized that chronic illness is a significant cost factor in this country. We do such a poor job of taking care of chronic illness, we let it go too far, too long before we address it. So this part of the law changes how we take care of chronic illness. This is a great part of the law. I encourage you to read it because this is a part that does not need to be thrown out. Title V. It's the healthcare workforce, 256 pages. I call this the jobs bill. We're all of a sudden going to have 20 million to 40 million new people entering the healthcare system. Who's going to take care of them? We have decimated our primary care workforce over the past few decades. This is because of fee-for-service. Now there will be more incentives for physicians to enter primary care. Their school loans could be repaid if they go to low areas where are in great need of doctors. There's also movement towards increasing the number of physician's assistants, nurse practitioners, and other ways that we can rebuild our primary care workforce. Countries that have strong primary care systems are actually healthier countries, so we need to do a great job rebuilding ours. I strongly encourage you to understand this part of the law and encourage your legislators not to throw this part out. Title VI is called Transparency and Program Integrity, Fraud and Abuse Provisions. We waste over $100 billion a year in fraud and abuse, and this is sad. We shouldn't be doing this. So this part of the law cracks down and puts into place different ways we can track fraud and abuse. So for example, last year, because of this law, we recovered $4.1 billion from Medicare. That's a good thing. And there's still fraud and abuse are rampant, and we've got to pay attention and track it. That's what this part of the law does. Title VII is called Improving Access to Innovative Therapy. I was so excited about when I read the title of this one. I thought, oh wow, they're going to talk about genomics. They're going to talk about social media in healthcare, because there's so much great stuff we can do with social media in improving healthcare for the masses. And it didn't talk about that at all. Basically, this part of the law talks about improving access to generic drugs. I can't believe it took 65 pages to do it, but it needed to be done. Title VIII is called Community Living Assistance Services and Support. This basically created a federal long-term care insurance program. When people get elderly or have significant illness towards the end of life, care can get very expensive, and regular health insurance doesn't cover this. Ted Kennedy was the champion of this part of the law, and if you remember, he died during the debate and passage of this law. So this was included in deference to a great statesman. Unfortunately, though, this was not his greatest work. This law had a lot of problems. It basically worked like the Social Security disability system, which we already know has a lot of problems. It would have been implemented through payroll tax, and people could have opted out. So it would have been a lot of work on our employers. That just wasn't a good thing. But plus, since people can opt out, only the sickest people would really buy this. So it has what we call adverse selection. Only sick people buy it, and only sick people use it, so the cost would be very high. This was really not financially sustainable. So the good news is, this proves the law can be changed. The Department of Health and Human Services investigated this part of the law. They realized it wasn't financially feasible, so they decided not to implement it. So it shows that we can make this law adjust as we find the parts that don't work. So that's a good thing. This long-term care part of the law is basically on the table. Title IX, revenue provisions. How in the heck are we going to pay for this big package of health care? 93 pages of what I call the tax bill. Basically, people who make over $250,000 as a couple, $200,000 as an individual, will pay increased tax on unearned income, so dividends, capital gains, interest income, and this is only on their income above $200,000 or $250,000, so not income below that. These same high earners will be subject to an additional 0.9% Medicare tax, so everything they make over $200,000, $250,000 will be an additional tax on their payroll under Medicare. So people under these income amounts, $200,000 and $250,000, will not be subject to this tax. There are a lot of other tax items in this law, mostly dedicated towards corporations. Pharmaceutical companies, health insurance companies have to pay a big chunk towards this law, and there are other small revenue provisions in here. Finally, Title X. Title X is called Strengthening Quality Affordable Health Care for All Americans. If you remember, Title I was called Quality Affordable Health Care for All Americans. So in the same law, they felt like they already had to strengthen it. I found this quite amusing. Basically, I call this the bucket list. In this part of the law, which was actually the hardest part to read, they went back and changed a lot of the earlier provisions. They also put in all the favors that people needed to get this law passed. So for example, the NRA has 2 pages in this law basically devoted to gun owners' rights to make certain that gun owners are not discriminated against in health care. Also, the Nebraska senator said he wouldn't vote for this law unless their state was not subject to the Medicaid expansion rules. So that is in this part of the law. There are also a lot of good parts in this this part of the law, and that's a lot of pilot programs on how to improve care. So much we can do to make our healthcare system better. So that's it in a nutshell, our healthcare system in our healthcare reform law in 10 minutes or less. Thank you for listening, and I hope this has helped you understand healthcare reform much better.